The month of December usually is very stressful for me. During the holidays, I tend to have almost zero time for myself. I usually like to get a proper massage from a massage therapist every other week to decrease tension in my scalp, neck, and shoulders. With almost zero time left during the holidays, I have discovered something that has helped me tremendously with my stress relief. That brings me to today's sponsor. Breo's portable massagers are one of the best in personal health and everything that you need in regards to relaxation. When I'm stressed, I usually tend to lose a lot of hair and I see dandruff, especially on my clothes, on the shoulders. I've noticed that since using the Breo scalp massager, there is definitely less hair falling off. I can see it on my hairbrush, which is amazing. You can either use essential oils, you can insert them right here, or you can use any kind of treatment that helps with dandruff, itchy scalp, or hair growth. And that has really helped me a lot to de-stress, usually in the shower. If it's, hot water, it helps with vasodilation and hair growth. Since I don't have a lot of time during the holidays and I can get a massage from an actual person, I have found the scalp massager to mimic exactly the hands of a trained massage therapist. It is a very good companion on the road. You can take it with you on the plane. You can put it in a very small purse, and I just take it with me now everywhere I go. I love using it in the office as well. It is very silent, so that's really good whenever you don't want to bother your partner or your coworkers. And trust me, nobody will think that you're weird. You're just taking care of yourself. Since it has a waterproof design, it is very easy to clean, and we all know how, things can get messy. So I usually like to wash it in the shower. When I use it on my scalp, it already has a lot of foam, and then I just rinse it with water. You guys also know that I have a lot of neck and shoulder pain. It's mainly based on the fact that I have TMJ and I tend to tense these muscles a lot, especially when I'm stressed. Since we can't get a proper massage from a real person, I have found this deep tissue neck massager to be almost as similar as the massage techniques of therapists. Now, if you love these products and you would like to give them a try, go ahead and use the link in the video description. Usually these promotions help my channel a lot, and we are able to use the resources to grow our audience and make sure that we are reaching lots of people who use ASMR on a daily basis to relax and de-stress. Thank you, Breo, for sponsoring today's video, and thank you for watching. Hi, Anna.
Hello, nice to meet you.
Nice to meet you too. My name is Dr. Matt. I'm going to do your exam today.
Okay.
Can you please verify your last name and your date of birth?
Johnson, 10/17/1993.
Okay. And go ahead and tell me what's going on with you.
I've been experiencing some bad migraines the last couple of weeks.
Okay.
I'm having some sinus pressure in my nose and some pressure behind my ears as well.
Okay. Is there anything in particular that might have triggered your symptoms? Did something happen 2 weeks ago?
I had a very bad cold a couple of weeks ago, but the pain in my ears and the headaches haven't gone away since.
Okay. Are you experiencing any flu-like symptoms right now?
Not anymore.
Okay. And do you have any vision changes, any blurry vision or double vision?
Sometimes.
Okay.
Sometimes I feel like my vision is a little blurry the last few weeks.
Any changes with your smell or your taste?
I'm having a little bit more trouble tasting.
Okay. And what about your hearing? Any problems with that?
A little bit, just because of the pain in there.
Okay. Is it on both sides or just one side?
Both sides.
Both sides, right and left ear. Any pain in your neck? Do you have difficulty moving your head left, right, or up and down?
Not a lot of pain.
Okay. So for the pressure in your ears, on a scale of 0 to 10, how would you rate that?
About a 7.
Okay. And the pressure in your sinuses, how would you rate that?
About an 8.
Can you go ahead and show me exactly where do you think your sinuses are?
Right here.
Okay.
And in the back of my ears.
Okay. And for the migraines, how would you describe the pain? Is it sharp? Is it dull?
Sharp, throbbing pain right here.
Any surgeries?
No.
Are you taking any medications on a daily basis?
No daily medication.
Okay. Do you have any allergies?
Seasonal.
But no medication allergy, correct?
No medication.
Okay. What I'm gonna do, I'll do a cranial nerve exam. I'll test all 12 cranial nerves to make sure that neurologically nothing is going on. And then we'll go ahead and check your back as well and see if we can do any treatment to relieve some of that tension.
Okay, thank you.
You're welcome. So I'm gonna go ahead and start by taking your vital signs. You said there are no flu-like symptoms?
No.
Okay. I'm going to put this under your tongue. Okay, go ahead and hold it for me, please. Thank you. This will go on your index finger. Go ahead and relax. And we'll take your blood pressure as well. I'm gonna have you uncross your legs, please. Okay, so we're gonna leave that there. Let's go ahead and check temperature. Good. Go ahead and open your mouth. 97.4. Did you have anything to drink before you came in?
No.
Okay. All right, perfect. So oxygenation is 98% on room air. Heart rate a little bit elevated, 91. Okay. All right. Go ahead and extend your arm. Sometimes with migraines, people might experience some high blood pressure, but yours looks very good. I have no concerns there. Let's go ahead and check your heart now. Is it okay if I open the gown on the right side? I'm going to slide the stethoscope under the shirt, okay?
Yes.
Okay. So I'm going to have you breathe normal for me, okay? Okay, so I can hear only S1 and S2. No S3, no S4. We're going to switch and listen with the bell. Looking for any murmurs. Okay, go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Very good. Now I'm gonna ask you to take a breath in through your nose and out through your mouth. Okay, just a little bit stronger this time. Very good. Okay, let's go ahead and listen to the sides as well. I'm gonna have you lift your arm a little bit. Good. Okay, we'll do the same thing on the other side. Breathe in and exhale. Good. Perfect. Okay. Blood pressure was 110/65. Lungs are clear. No signs of pneumonia. S1, S2, and no murmurs. Okay. So we're gonna go ahead and start the cranial nerve exam. Okay, I'm going to go ahead and put gloves on. Are you experiencing any numbness or pins and needles in your fingers or toes?
I am experiencing a little bit of pins and needles in my toes and my hands.
Okay, and do you remember how long ago did that start?
About 2 weeks ago when I had my cold.
Okay. I'm gonna go ahead and start by palpating your face. We're gonna check your sinuses and lymph nodes behind the ear to make sure that nothing is swollen, okay? Alright, so just slowly palpating, starting with sinuses above your eyebrows. Not feeling anything swollen. There is a little bit of puffiness. And under the eyes. Any pain when I'm doing this?
Just a little bit of pressure.
Okay. And here?
Also a little bit of pressure.
Okay, I'm going to close one ear. I'm going to have you breathe in, breathe out through your nose. And the same thing on the other side. Breathe in, breathe out through your nose. Okay. Alright, we're palpating the lymph nodes in front of your ears, preauricular lymph nodes. Submental. Postauricular lymph nodes behind the ear. I'm not feeling anything swollen, so that's good. I'm going to move down the neckline. Just palpating here to see if there's anything swollen again. Go ahead and shrug your shoulders for me. Good. Okay, and relax. I'm going to make some movements with your head. Go ahead and relax your neck and your head and try to let yourself guided by me. We're just going to make some short movements here to see the range of motion. And all the way down. Okay. Can you go ahead and do a 360 degrees rotation with your head? Any pain there?
No.
Okay, go ahead and switch. Okay. Okay. So we're gonna go ahead and start with your ears. I'm going to make a vibration sound with a tuning fork. I'm gonna need you to tell me when you don't hear the vibration anymore.
I don't hear it.
Okay. What about now? Tell me when it stops.
Stopped.
Okay.
Stop. Stop. Stopped. 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 Stopped.
Okay. Everything looks good so far. Going to check inside your ears to see if there is anything swollen. I'm gonna have you turn your head to your left. Okay, and I'm going to insert the otoscope inside the ear very gently and taking a look to see if we can visualize tympanic membrane. Get normal color, pearl gray. I'm not seeing any cerebrospinal fluid leakage. Looks good. Let's go ahead and check your other side as well. So I'll do the same thing. Go ahead and turn your head to the right a little bit. Kind of difficult to visualize on the left side. But there's no redness, so I think that looks good. Let's go ahead and check your vision next. Okay, we're going to check your ocular nerve. For this, I'm going to ask you to look behind me, straight at the wall, and try to keep your eyes open, okay? Our nerve is intact. Okay, very good. Can you go ahead and cover one eye for me? Okay. Can you please tell me what shape you see right here?
A star.
Okay, and what color is it?
Yellow.
And what letter do you see?
E.
Okay. What color is this?
Red.
Okay, go ahead and switch eyes. What color is this?
Red.
And what do you see here?
A cat.
Okay, what color is the cat?
Black.
Right. I'm gonna have you look straight in my nose. I'm going to flash a light in your eyes. Okay, so we're looking for pupil dilation and constriction. Go ahead and keep on looking at my nose. There's no abnormal color. Very good. Can you please follow my light with your eyes only? Don't move your head. Okay, a little bit of shakiness there. Go ahead and look right here for me. Okay, that's negative. Sounds good. Go ahead and look here. Okay. I'm gonna have you cover one eye. So same thing. And can you please tell me when you see the yellow ball in your field of vision? Go ahead and look straight in my nose and try not to shift your eyes anywhere else. So go ahead and tell me when you see it in your field of vision, okay? Do you see it now? What about now?
I see it.
And now?
No.
Okay.
I see it. I see it.
Okay, keep on looking here.
I see it. I see it.
Okay, let's go ahead and switch eyes. Okay, do you see it now?
No.
Good.
I see it.
Okay, a little bit of periphery vision loss on the right side.
I see it.
Okay, same thing.
I see it.
Okay. All right. I'm gonna go ahead and check your mouth. I'm gonna have you give me a big ah. Okay, just a little bit more. Good. Your last midline. I'm gonna have you move your tongue up and down for me. Okay, side to side. And try to push your tongue inside the cheek like this. And the other side. All right. Go ahead and give me a big smile. And a frown with your eyebrows. All right. Go ahead and try to lift your eyebrows up. Okay, I'm gonna try to push them down. Don't let me do that. Okay, a little bit of weakness there. Go ahead and try to turn your head this way. I'm going to push you, so try to resist. Very good. We'll do the same thing on the other side. Very good. I'm gonna have you shrug your shoulder as I'm pushing down, okay? Okay, go ahead and give me a big squeeze here. All right. Go ahead and cross your legs. Okay, can you please push your left knee a little bit higher? Good. Same thing on the other side. Okay. Go ahead and put your arms like this in front of you. So what I'm gonna do, I'm gonna try to push them down. Don't let me do that. Okay. Some weakness on the right side. All right, don't let me do that, okay? I'm gonna try to push it up now. Okay, gonna try to open them. Don't let me do that. Okay, go ahead and hold them like this. I'm gonna try to close them. Don't let me do that. Okay, go ahead and relax. All right, we're gonna check your taste now. You did mention that you're having some problems, some new problems, right? Okay. So what I'm gonna do is I'll put a paper on your tongue. Okay, so I'm just trying to grab here only one paper so that we don't maximize the flavor. Go ahead and give this a taste. Let me know what it tastes like. Sweet. Okay. Let's go ahead and try one more.
Bitter.
Okay. So everything looks good so far. Okay. Sour. Okay, and last one.
Sweet.
Okay. So you did get two of them wrong. One of them was sweet, but the other one was salty. So I think we do have something here. Let's go ahead and check your nose now. So we were able to tell that your nares are patent. There's no obstruction there. I'm gonna have you close your eyes. Just go ahead and tell me what this smells like.
Cinnamon.
Okay. What about now?
Mint.
Okay.
menthol, cinnamon.
Okay, everything looks intact here. Okay, I'm gonna go ahead and check your reflexes now. Go ahead and lower your jaw a little bit, just a little bit more. Relax. Kind of like half, just open your jaw a little bit. Perfect. Okay. So we're looking for deep tendon reflexes. Okay. All right, I'm gonna have you relax your whole arm. Put your weight on my arm, okay? So relax. Good. Okay. Go ahead and relax. Good. Okay, so relax your arm. Good. Perfect. Okay, and now go ahead and put your palms up for me and kind of like curl your fingers just a little bit. Don't just relax them, just curl like that. Okay. Relax. Okay. Good. And now we're going to check your patellar reflex. Very good. Okay. Good. Okay. Neurologically, everything looks good. Let's go ahead and check your facial sensations now. I'm going to touch you with two textures. One is going to feel sharp. This is what sharp is going to feel like. And the other one is going to be dull. It's going to be kind of like a fluffy, dull sensation. So first, go ahead and tell me if you feel it. So you say yes or no.
Yes. 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 Yes.
Okay. Now tell me if it feels sharp or dull.
Sharp. Dull. 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 Sharp. 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 Dull. Sharp. 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 Dull.
Okay. So let's see what we have here. Okay, I think we're gonna go ahead and have you lay down on your belly, and I'm going to check the back of your neck as well, okay? Okay, I'm gonna go ahead and start by palpating your lower spine. So we're looking at S1 and S2. Let me know if you feel any kind of pressure or pain as I'm doing this. I'm going to slide my fingers up the spine, looking for any inflammation that might be triggering some of your neurological symptoms. going to go ahead and kind of pinch your skin on the lower side of your back. Let me know if you feel any kind of pain as I'm doing this, okay?
Okay.
Any pain there?
No pain.
Okay. All right, go ahead and tell me if you feel this on the left or right.
Right. Left. Left. Right. Right. Left. Left. Right.
Okay, I'm gonna go ahead and sit down and we'll continue to examine your spine and posterior neck. I'm going to start by palpating to get a sense of the level of inflammation that you have here. I would definitely want to rule out any abscess or any kind of infection. Okay. So I'm going to tap on your spine. Let me know if you feel any kind of pain. We're looking for neurological responses, any sudden movements in nerves or deep tendons. Okay. I'm going to go ahead and gently press in the skin to see exactly the level of indentation that we have. This allows me to understand how much inflammation there is in the neck area. Let me know if you feel any kind of pain. All right. So we're checking left and right. The right side was a little bit more compromised when we did the physical assessment. Okay. So we're gonna go ahead and use a tuning fork. Can you please tell me if this feels cold or warm?
Cold. Cold. Warm. Warm.
Okay. I'm going to touch you with two textures. One is going to feel sharp and the other one is going to be dull. Go ahead and tell me if it feels sharp or dull.
Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay, and I'm going to focus on the hairline as well. So go ahead and tell me if this feels sharp or dull.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Okay.
Dull. Dull. Dull.
Okay, I'm gonna go ahead and start taking a look at the scalp as well. Okay. Does this feel cold or warm?
Cold.
What about now?
Cold.
And now?
Cold.
Okay. What about now?
Cold. Warm. Warm.
Okay. Go ahead and tell me if you feel this equally on both sides, left and right. Does that feel equal?
Equal.
Okay, what about now?
Left.
So you felt a little bit more on the left side?
Yes.
Okay, tell me when you don't feel the vibration anymore.
I don't feel it.
And what about now?
I don't feel it.
Okay. So I'm gonna go ahead and just slowly palpate the mastoid bone behind your ear. On both sides, we're looking at any inflammation. I'm not feeling any puffiness. Okay, and it seems like the tension is going down the neck, just a little bit below the hairline. Alright, you might be experiencing some increased pressure inside the ear canal. So I do have a device that's definitely going to help. I'm going to go ahead and place it inside the ear canal. Okay, you're gonna feel kind of like a puff of air, but this usually helps to release the tension. Any pain?
No pain.
Okay. And I'll slowly release. We will do that a few times. Any pain?
Just a little.
Okay. Let's go ahead and switch sides. Any pain there?
Just a little pain.
Okay. What about now?
No.
Okay. Okay. So that usually definitely helps to relieve some of that pressure. I'm gonna go ahead and apply some anti-inflammatory oil on the lower side of your back. And we're going to use cupping therapy to kind of increase circulation in this area. Okay. So this definitely doesn't hurt. Let me know if you feel any kind of pain though, okay? Any pain with that?
No pain.
Okay. Okay, we'll do the same thing on the right side. Okay. We're gonna have to go ahead and close the gown, and I'll have you sit back on the table, and we're gonna go ahead and discuss the results. Okay, I'm gonna go ahead and take my gloves off. And I did see some inflammation in the back of your neck. I'm gonna have you go for a CT of the neck, head, and shoulders.
Okay.
All right, so I'm gonna write that down for you. And whenever you get the results from that, I'm going to call you and let you know what we need to do next. But how is the pain right now after the treatment?
It's feeling a little bit better. I'm having a lot less pressure in my ears.
Okay. Well, I'm very glad to hear that. If you have any questions, go ahead and give us a call, and we'll be more than happy to schedule you again. All right?
Thank you very much.
You're welcome. Thanks for letting me have this exam with you. I'll be back soon.